Yes, sir, right there. Right there, sir, in your glasses. Go ahead. One of the focuses on the long-term benefits is the attempt to refocus money and time on prevention, such as lifestyle changes, as well as cessation of smoking, weight loss, but to talk about the long-term benefits as a part of the program as well. And how do we get the benefits?
Well, I want to, as a preface to this question, I want to thank my fellow panelists and apologize. I don't mean to be dominating the time, but there seems to be some demand for it. Thank you for the question. And I think it's a very important one. That is, we're very focused on the costs, as we should be, but we can't lose sight of the benefits, which are very extraordinary as well. And how do we measure those benefits? Well, probably the easiest barometer, among others, is how many millions more Americans do we provide health care for that don't have it? What do we do to the costs of health care for those who currently have health care? Are we able to stop that health care cost curve from going out of control and rising exponentially, and more employers dropping coverage? There are 1,000 people every day that are dropped in this state alone from their coverage. So sometimes it's harder to measure the positive outcomes on the front end, but I think the gentleman raises a very important point that I want to emphasize, and that is, this is an unsupportable status quo. I'm not old enough to remember the debates over Social Security, but I'm sure glad that my predecessors had the foresight and the courage to advance Social Security. And I'm sure glad that my predecessors had the courage and the foresight to advance Medicare. It's helped millions of seniors that wouldn't have a chance for quality health care. And I hope that we have the courage and the foresight to do something great for this country in extending coverage to millions of people who don't have it and bringing down the cost for millions more. That's what this debate is all about.